Healthy Nation. Your health, your wealth.
Hello there. I hope you're doing great. I know tonight we have one thing on our minds, and that's the World Cup final, right? That's later tonight. And of course, the reason I'm bringing that up is because there is a conversation that could, in a sense, link to what is happening in our bodies around such moments. It'll make sense once we introduce our guests later on. But for now, this is Healthy Nation, and I'm Janet Mbogwa. We're talking about hypertension. It's often called the silent killer. Why? Because it's living undetected in the bodies of millions of Kenyans. Millions, right? And that's something that we really need to think about. Look around you right now. If it's your friends, your family, this is not to cause panic. It's really just to give you the right information about hypertension. But first, to really root us in this conversation, take a look at this clip. Here's the pulse check.
There was a topic called hypertension.
High blood pressure.
High blood pressure.
High blood pressure. Obesity is one of the very common risk factors. Smoking is a common risk factor. Physical inactivity, that people who use a lot of salty food, a lot of spicy food.
Please make sure it is below 135/85.
High blood pressure doesn't feel like anything until it takes away everything.
We have seen people's lives drastically change for the worse.
High blood pressure doesn't feel like anything until it takes away everything. That clip there really sums it up really well. We're now going to take a deep dive into the data. Let's have a look at some of those numbers to really ground you in why this conversation is so important for us to have on Healthy Nation and why this is a conversation that we continuously need to have. We're also inviting you to share your thoughts with us. You can watch us live on YouTube. Make sure you're following us on our feed as well as Facebook. You can also call us. I'm going to read that number actually for WhatsApp in just a moment so that we can begin to hear from some of you. That number here, I should by now have really memorized this number. Here I am grappling, trying to find it. There we go. 0769 590 760. 0769 590 760. That's the number that you can WhatsApp, right? Just so that we can begin to hear from you. But let's now see whether we can take a look at those data points to take a look at some of the context around hypertension, right? And the first one talks about the fact that 1.4 billion adults aged 30 to 79 are living with hypertension worldwide. That is 1 in 3 adults in that age group, and 2 out of every 3 of them live in low and middle income countries like Kenya, right? That's according to the WHO. That's some of that data. The next picture we can give you is taking a look at the continent. Africa has one of the highest burdens of hypertension globally. About 1 in 3 adults in the WHO Africa region has hypertension across 37 African countries. 29% of women and 26% of men are affected. And these rates rise sharply with age. Hypertension is one of Africa's fastest growing NCDs, or non-communicable diseases. That's some pretty jarring data. Let's now bring it to Kenya. 24% of Kenyans have elevated blood pressure or are already on treatment. But here's what stopped me. More than half of all Kenyans, about 56%, have never had their blood pressure checked, not once. Not once. And we're going to find out why in just a moment when we introduce our doctor this evening. Okay, let's keep going with this data. Of Kenyans living with hypertension, only 15% know that they have it. Only 8% are receiving treatment, and only 4.6% have it under control. And so again, we mentioned earlier that 56% haven't even been checked before. So there's a lot of undetected, people living with hypertension and have no idea that it's living in their bodies. And then finally, more than 10 million deaths worldwide every year are linked to uncontrolled high blood pressure. So every hour, we're looking at more than 1,000 people or so dying from heart attacks and strokes caused by hypertension. Oh, and again, we'll be introducing somebody who'll give us the details behind the numbers, just so that we can begin to unpack what this looks like. We've talked about all of these different numbers, but what does that actually mean? Of course, we have with us Dr. Anthony Ochola. He's a cardiology fellow, and he joins us this evening. Thank you for being with us today.
Thank you for having me.
Right, it's really good to have you. And later on, of course, we'll be speaking to Dr. Diana Gitao. She's our in-house GP, taking some of your questions related to this topic or other. That'll be a little bit later on. But first, Daktari, and earlier he was like, why are you calling me Daktari? You should wear that thing like badge of honor. Badge of honor. I was going to say, all of these numbers, it sounds very alarming. 56% of Kenyans have not been checked, right, for hypertension. 1.4 or so billion adults, right? So just give us that snapshot. When we talk about hypertension, what exactly do we mean? And then we'll keep going deeper into that threshold of when you should be worried.
Okay. So hypertension, as most Kenyans will refer to pressure, basically is when your blood pressure is elevated above the normal. The different cutoffs that we use, but the latest in terms of cutoff is a blood pressure of 130 over 80, meaning that the upper number, it reads above 130, that's when your heart contracts, and then the lower number reads above 80, that's when your heart relaxes. Mm-hmm. So you put this together, that's hypertension. Now, the numbers you've read here are quite astounding, to say the least. The reason is that blood pressure hypertension is asymptomatic. Patient does not feel any symptoms at all until complications arise. Mm-hmm. And because of that, most people will not seek care. So you'll have 1 in 4 people probably having hypertension. And out of those who do have hypertension in that group, half of it do not know they have it. And by the time they're finding out, you already have organ effects of the body, and the body is failing in one way or another, and it's a bit too late, which is sad because it's something we can prevent.
Yeah, and I know we'll talk about that later in terms of how to prevent it. How does it show up at your door, Dr. Ochola, when you talk about uncontrollable hypertension? When it arrives at your door, when you're trying to seek treatment for your patients, what does it usually look like?
So, being an internal medicine specialist who's in cardiology, sometimes you get to see the more dramatic part of it, which means someone comes in having had a stroke. They either had a clot in their brain, or they've bled into their brain, or they come in with a heart attack, or they come in with a heart being failure. Or sometimes the kidneys are just not functioning. And the reason why you think about it is this way. So I look at the blood system, the blood vessel system in the body, like a series of pipes. So imagine that the pressure within these pipes have been building up over time. What happens is these pipes, which are blood vessels, become stiff. And as they become stiff, they give in at certain weak points. And these weak points, unfortunately, usually are near the vital organs of the body. And as a result, by the time they present dramatically, one of these organs is failing. Now, the other way that they present to us is during a routine screen, someone comes in for flu or just a visit to a pharmacy, and they measure the blood pressure and it's up. And sometimes you find it's a young person with no particular risk factors, and they're sent to clinic as a result. And so we don't see much of that. Usually it's the dramatic side. And I guess that's why I'm here today.
That's why you're here today. And you, as you said, it doesn't have to get that dramatic.
Doesn't need to.
How do you the reason I started by talking about the World Cup? I talked about it because it's a moment of celebration and high feeling. So maybe I'm reaching, Doc, and you can be like, Janet, you are reaching. In the sense of, sometimes you can feel like you have an elevated feeling, and it's natural, around excitement, fear, whatever it is. Is there any link to that? And is there a threshold to where that kind of elevated blood flow or whatever can be dangerous?
So an acute stress, for example, if you're a France fan and your team is losing, or you're driving to work and the engineer did not fix the road appropriately and you hit your car, or you get into the office and things are just not working for one reason or another, this can cause acute elevations in your blood pressure.
Okay.
Now, most people will say, oh, I have hypertension because I'm chronically stressed. That is not correct. An acute elevation during an event should settle down. If it does not settle down consistently, then it tells you that there's underlying blood pressure that's unlikely related to the acute stress you're ongoing.
Okay. So I wasn't reaching.
No,
too
you're not
far.
reaching.
It's a good caution to put out there, right? For what's
Very
happening
true.
tonight. I wanted to ask you which team you're supporting, but you might say it's going to get divisive here.
Anybody but Argentina.
Anybody? You're already giving people. We're supposed to be calming people down. There's somebody I know who talked about, they're 22, they eat well, they don't drink, they exercise. Can somebody like that get hypertension?
Yes, indeed. As you're seeing even our demographics in our African population, you notice the numbers you read. 25%, 26% of men and women around the age of 30 having high blood pressure. Now, previously it was thought that blood pressure is a disease of the elderly. And unfortunately, because of risk factors that come with a modern lifestyle, the foods we take, the lack of exercise, overindulgence sometimes, these lead to younger people having elevated blood pressure. Now, there's also another small subset of patients, about 10% of patients, who would have a secondary cause of them having high blood pressure. So something within their body that could be causing them to present earlier, that sometimes if you're able to correct, then you're able to manage blood pressure even better.
Okay. Let's go back again to some of these basics of, first of all, why it's presenting that way in certain demographics, in women, more in women, more in low and middle income areas. Talk to us about that, because again, this speaks to a very large number of people watching and listening who are sitting with this.
Yep.
Why is it?
I'll start with the gender thing. So first of all, one of the risk factors for having hypertension that you cannot change is gender. And the male gender is actually more affected.
The male gender is more...
The male gender is more affected. The difference is women have a better healthcare seeking behavior. So you're likely to pick up these people high blood pressure and get them on treatment. Now, when you look at why is it that in our lower middle income areas is that we're finding a lot of this? So first of all, we're not screening. Second of all, what's our lifestyle like? We're eating a lot of processed foods. We're having a lot of extra salt in our diet. We're not getting adequate exercise. We might think we're getting exercise, but it's not adequate exercise. We tend to overindulge in alcohol. We tend to take tobacco, which should not at all. And generally, quality of sleep is also not good amongst this population for various reasons. And for that, you get a hike in your blood pressure readings.
Yeah. Oh, that's really frightening. And the fact that, there seems to be a huge issue around screening. And we've had several conversations here. Part of it is access. Part of it is awareness. And I think one of the things we're trying to do with this platform is that make sure health solutions can reach you, that you know about them. From your point of view, is there a massive gap when it comes to more people being able to screen for hypertension? Or are there services that exist, but we just don't have enough people coming to access them?
Yeah, so blood pressure should be one of those things that in this day and age, you should be able to measure it at home.
Right.
You should be able to walk into a pharmacy, buy a blood pressure cuff, have it. You've tech savvy, go on YouTube, see how to use it, get your number readings. If the readings look off, see a healthcare practitioner. Now, I do understand that most people might not have access to this. But at the same time, I think in our public health system, and as part of just sensitization, we should have someone be able to walk into a health institution and get their blood pressure readings done. Now, the society of which I'm part of, the Kenya Cardiac Society, once a year during May, we do actually have a May measurement month. So what that means is throughout Kenya and throughout different institutions, you walk in, you get your blood pressure checked and establish follow-up after that. And usually we see a spike in people coming for follow-up, being seen after that, and then of course it drops off. I would love to see this sustained through the year.
Okay. Yeah, we need more people to be okay with being screened. Again, we're reminding you that you can call in, you can WhatsApp, you can join our live feed to just start asking your questions. You mentioned you said that people don't exercise enough. What does it look like to exercise enough?
So someone might say, well, I've been up and about the entire day.
Yeah.
So I've exercised. I've walked here and there. I've done this in the office. So I'll define exercise as this. If you can do 30 minutes of an activity that raises your heart rate above your baseline for at least 30 minutes, 3 or 4 times a week, that is adequate exercise. So it's not about, me deciding I've walked 10,000 steps within the office. That's not sustained exercise. And it doesn't reduce your risk factors as much as just setting aside 30 minutes or having...
Wait, I could push back because a majority of Kenyans walk to work.
Yes.
For long distances,
Yes.
way more than 30 minutes.
Yes.
And they do that maybe 4 times a week, 5 times a week.
Mm-hmm.
What about that?
Is it sustained? That is the thing. So one of the things I like is this. So let's say you have this healthy young man, 30 years old, has a resting heart rate of 60 to 70, and they walk every single day.
Mm-hmm.
For their level of activity, that's not enough exercise. I'd want them to bump up, get more intense, 30-minute session where they're getting the heart rate to at least 100.
Mm-hmm.
And for the person whose heart rate, baseline heart rate is a bit higher than that, get it higher, and then then you'll have reached the threshold to see the benefits.
Okay. We're going to bring a question up on screen in just a moment, just to be able to share. There we go. I think it says, hello, Healthy Nation. When I sleep at night, I feel my heartbeat in my ears. Is that dangerous?
As a cardiologist, I will tell you it's concerning. It might or might not be elevated blood pressure, but there are other reasons to why your heart would race at night. It could have something to do with the conduction system of your heart, so your electrical wires within the heart. Sometimes could be passing electricity abnormally. If you do feel palpitations, which is your heart beating when you're settled, I would advise you see a doctor and have an ECG done. And from there, you can see what to do.
Okay. Well, again, please keep sending your questions on WhatsApp. We're going to put the number on your screen so that you're able to send us a lot of your WhatsApp questions. This is something that's affecting a lot of people. They don't know about it. It's kind of laying hidden in your body. So please make sure you ask your questions now. This is as good a time as any to have somebody like Dr. Ochola in studio just to give us a bit more guidance. I'm trying to find a way to break this down in the simplest way, right? Because what I'm hoping can happen is somebody leaves this program knowing the very basic ways in which they can check if they have blood pressure without being hypervigilant. We're in a very hypervigilant society nowadays. So talk to a family of parents and their children. Look at all those demographics. You have a mom, a dad, maybe a son who's 17, stressed out studying for exams, and maybe a daughter who is in uni about to go to work. Just walk us through what should all of these family members be keeping in mind as they continue to navigate things to really keep down the chances of having high blood pressure.
Yeah. So the first thing is I would make it a family affair in the sense that put it on your calendar for screening, meaning pick a day in the year, whether it's someone's birthday, some anniversary or something, and just have your blood pressure checked. If you can do annual physical lab examinations, that would be amazing. The second thing is just being vigilant about what you're doing on a day-to-day basis. I would say, number one, do not smoke. And if you smoke, quit, because tobacco in itself is a very high risk factor for hypertension. The second thing, reduce alcohol. If you can stop it completely, it will be amazing. Alcohol increases your risk of any hypertension at least 8 times. The third thing, get moving. You do not need to do anything dramatic like hitting a gym. Just a 30 to 40-minute brisk family walk every other day is enough to get it done. Fourthly, let's look at our plates. Let's look at our kitchen. Let's try and reduce on processed food. Let's try to get a bit more vegetables in, a bit of the correct type of protein in. And this should be able to bring down the risks of your blood pressure over time. Yep.
Okay. And yet, is it something that you're just seeing getting worse? Because somebody watching this could argue and say, my family and I do all those things. We don't smoke, we don't drink, we try and eat food, guashendo, healthy foods, our traditional foods. Sometimes I say that lightly because there's a way some could be cooked in a way that's also, makes it a bit dangerous, too much oil, etc. But they could be saying, Dr. we do all those things. We try to manage our stress levels. We try to make sure that we're eating well. We try to make sure we're doing all this. So therefore, what else could I be predisposed to? Is it also something that's genetic? What else is it?
I'm glad you brought it up. So there's some risk factors you cannot change. You cannot change your gender. The fact that you're male increases your risk. The older you get, right from 18, risk goes up. You can't change that. Genetics, you cannot change that. It just has to do with the way your body regulates blood pressure. Right. And if you have a genetic inclination to having high blood pressure, you're going to get it. But it doesn't mean it's the end of the world. The biggest thing, like I said, is we need to pick it up. And once we pick it up, get you an appropriate treatment, get your blood pressures down to target, and from there, your life and the person without hypertension, your risk is almost the same.
And once you bring that risk down, obviously it's not permanent. You can still get, I don't know whether to call them spikes or flare-ups. Please catch me if I'm using the wrong terms. But if somebody gets on a treatment plan early, are they good, or it's like, nope, you're good, but you need to also keep managing it this way?
So one thing I tell my patients when they leave my clinic is very simple. Write down a date, a time, and your blood pressure reading. Record it. When you see in clinic in a few weeks' time, I'm able to see what your trend is like, and from there, I'm able to make adjustments. And over time, you realize that patients who actually take it upon themselves, they'll actually call or text you and say, the last few weeks, my blood pressure has been elevated. What's going on? Can I come in sooner?
Oh, so they can do that.
Yes.
We'll come back to that in a bit. Purity One, Jiku, this is up on the screen. When you get painful blue color on your skin after some time and it disappears, what causes it? A painful blue color. I think I'm reading right. I know my eyesight isn't that great, but is there anything to do with color, skin, how it appears? Does that say anything about hypertension?
Most of the time, no.
Okay.
But sometimes when you see blue discoloration of the skin, it could be bruising.
Caused by?
And sometimes it could be either friable vessels, could be change in blood pressure. At the end of the day, if you go to any doctor to have the bluish discoloration checked out, the first thing they're going to do is check your blood pressure as part of your triage. I would recommend it. I'm not a dermatologist, but if you're getting easy discoloration of your skin, I would have it checked out.
Okay, that's interesting. Just kind of like drawing those links between how it shows on your skin, etc.
Exactly.
How often, I think you mentioned it, but just repeat if you haven't, how often are you supposed to have your blood pressure checked?
So this is what I say. If you have any risk factors like having type 2 diabetes, having strong family history of heart disease, or having hypertension in the family, having previously been noted to have borderline blood pressures, have any risks like tobacco use, overweight, which I know the very sensitive things, but any of those risks, I would recommend at least checking your blood pressure every 3 months.
Every 3 months?
Every 3 months.
Okay.
The lower your risk, I would ensure at least twice a year you know what your numbers are like.
So bare minimum, at least twice a year. Yes. Okay, out there, doctor, because again, we look at access to healthcare, access to medicine. Are there enough specialists for people to go for screenings? Is that another gap? Because there are people, again, watching this, they live far out.
Yep.
This is the first time they're hearing about some of these things, right? So how would you advise somebody like that?
So when it comes to blood pressure checks, thankfully we do not need a lot of fancy equipment or anything of the sort. In any medical system, when you walk in, the first thing they'll do is check your vital signs. And basically it's what's your temperature like, what are you breathing like, what's your blood pressure like. And this should be able to give an inclination whether you're hypertensive or not. I've seen there's a lot of initiatives going on with community health workers out there, even in my village in Dewa, Homa Bay, where they're actually checking blood pressure for people in the village. So I would recommend, if you can, walk to the nearest health center, and if it's worth their salt, they should be able to check your blood pressure, at least.
And at least give you something.
Yeah.
I know we have somebody called Monica Mutua. We're going to read your YouTube feedback very soon. I think as we go into the break, we're going to come back and answer it. But thank you for those of you who are sending your questions and feedback on YouTube. Once again, on our Facebook, our YouTube, on our WhatsApp, you can call in. We want to make sure that you have your questions answered, right? So we're going to go into a break in just a minute. And as we do that, doctor, what's the one thing you wish every Kenyan understood about their blood pressure, just before we go into
Just know your numbers. Know your top number and your bottom number. And if it's above 130 over 80, see a doctor.
Okay, straight up. Okay, we're going to go into a break. When we come back, once again, we are still in conversation with Dr. Anthony Ochola. We're talking about hypertension, often known as a silent killer. This is not to cause alarm, but I think it's important that we take some of these issues with urgency. He's talked about having your blood pressure checked. He's talked about having a conversation, even with your family and your friends. When we come back, we're going to take a look at some of your feedback on social media, on our WhatsApp, and really try and get to the root of how do we make sure we're getting better? How do we make sure we're getting better as a nation? Healthy Nation comes back in just a moment. Stay with us.
Enjoy modern facilities, practical training, affordable fees, and comfortable hostels. September admissions ongoing. Visit us today or call 0734 444 005. Lukenya College, transforming the future through training and innovation.
Harufu nzuri, manukato laini, Downy Pure Bliss. Imetengenezwa na manukato ya asili yanayokuweka kwa utaratibu kwenye hali tulivu. Ijaribu kwa shilingi 20 tu.
Indulge in the moment. With every spoonful, Delamere Real Fruit Yogurt.
The National Treasury is pleased to announce the official launch of the financial year 2027-2028 and medium-term budget preparation process on 22nd July 2026 at the KICC, beginning at 8:30 a.m. The general public is encouraged to attend or follow proceedings via the National Treasury's website and social media platforms.
Mene is always in and out of this place, always disappearing and appearing.
Mwezi atacha mtoto for 1 second apumue.
So umetafuta mali pa kupumua kuona this is the best place.
Alan is my friend and nimechoka kusikia hizo fake concerns about where I am, who I hang out with. You don't care about that.
Kwa hivyo hii siku moja imefanya ukamjua huyu mpaka kwa wanakutoka.
Mimi nyesta kitapa shola, nyesta kitu noma.
Join the Meru University Mount Kenya Mountain Run on 5th September 2026 and be part of a movement transforming lives. Run with a purpose. Run with MAST. Register today at mountainrun.mast.ac.ke.
The National Treasury is pleased to announce the official launch of the financial year 2027-2028 and medium-term budget preparation process on 22nd July 2026 at the KICC, beginning at 8:30 a.m. Officially opened by the Principal Secretary, National Treasury, and the Chairperson of the Budget and Appropriation Committee, National Assembly. This process fulfills constitutional requirements for public participation. The general public is encouraged to attend or follow proceedings via the National Treasury's website and social media platforms. Your active involvement is essential for the budget-making process.
You feel that? The crash zone.
Crash what?
The crash zone. It builds suspense, uncovers evidence, foreshadows danger. You feel it now?
Oh yeah.
I guess I'll go and try and find a ladder.
Thank you so much for staying with us on Healthy Nation right here on NTV. I'm Janet Mbogwa. We've been talking about hypertension. We're joined by Dr. Anthony Ochola, who has been talking to us about what it is, what are the signs to look out for. And in a moment, we'll be looking at, okay, so how do we go about treating it? And then later on, as we've said, we have Dr. Diana Gitao. She's our resident GP. There's a lot of questions some of you've asked during the week, right? Some of it is related to hypertension. Some of it is a little bit outside of that topic. She's on hand to make sure that she gives you answers that will help you as you continue to seek more medical advice or information. So we're still with Dr. Anthony Ochola, and in a moment we'll bring up what people are doing in terms of how they deal with hypertension. Talk to us about medication. That's also something that people hear and they think, okay, I'm already thinking about the expense. I'm already thinking that this is medication I have to take for my lifetime. How does medication work when it comes to hypertension?
Yeah, so one of the things about treating hypertension is we usually start you on medications based on your risk factor profile and what we think would work best for you. And once we start on the medication, we see how your blood pressure is controlled over time. Normally what I see is some patients will be like, oh, my blood pressure is now controlled, I'll get off the medication. I would say do not get off the medication. Why? The fact that your blood pressure is normal when you're taking the medications, it means that the medication are working and it's decreasing your risk factor for organ injury. If your blood pressure is consistently high despite medication, or is consistently very low, and by very low, I mean the top number is less than 100, then start thinking about, come back to your doctor and be able to make adjustments as necessary. Most of the time, the patients we see, they'll be on a dose for some time and either titrate it up or down, depending on their response. But what I would advise is take your medication consistently, daily, preferably on a particular time schedule.
And that can go for as long as what, a month, 2 months, a year?
Most of the time it's a lifetime thing. But I always say you're going to live long enough and you will take medications, but you're going to live a full life.
I'm going to need to process that. So you can be on lifelong medication just to manage it, to manage your numbers. Wow, okay. There's something else that I was going to ask around SHA, and you can say what you're able to around this, which is, what does it cover when it comes to something like hypertension? Is it monitoring? Is it medication? I'm
going to speak a bit biased.
Okay.
I think that SHA is rolling out. They're attempting to get things done. And at least when it comes to the basic screening and some basic medication, there is good coverage. Of course, like in any health system, there's a lot of room at which you could approach it. I'd love to see a situation where it will cover not just the medication, but the annual labs that the patient has to go through. And even if we need to do some specialized procedures to bring down blood pressure even further, that's a dream. But so far, I think it's been rolled out. Let's see how it rolls out over time.
Right, and how much it's able to cover. Because I think when we talk about a lot of these health matters, the first thing is, how am I going to access the treatment that I need when I'm trying to avoid going out of pocket, which has been a huge conversation in the last year and a half. Hypertension is rising fast among young Kenyans. Are we looking at a generation that it's just going to go downhill from here, or can we arrest it early?
I think we can arrest it earlier. Not all is lost. What we're dealing with is we have to be a bit more vigilant that, yes, our lives have changed from what our grandparents used to do, but also as we come up with policies that govern the public, we should be able to have more spaces where people can exercise. We should be able to have some sort of regulation in terms of what food we're able to access.
Right.
We should be able to have regulation on tobacco and alcohol, and we should have access to healthcare. And I think if we're able to address all these things in totality,
then we're going to have a healthier generation.
Precisely.
Purity, I think, has circled back on a comment, and it's there on the screen. She's talking about the medication she's on, and she says, if I don't take a painkiller, the blue bruises appear swollen and painful. What's the cause? So she's also named a medication. Are you able to speak to this?
Yeah, I can see you on aspirin. Aspirin is a blood thinner. Okay. Could explain why you're having bruises. The reason is, why are you on aspirin? I would recommend you see a doctor and see what's up. See also on a blood pressure medication, HCTZ. I would record your blood pressure during these episodes so that when you see your doctor, he's able to decide, is this an adequate dose of blood pressure monitoring? Is the indication for aspirin appropriate? Can we mitigate for you not to have bleeding episodes?
Wow, there's so many factors I'm keeping in mind. Things like also age. You talked about how it was always seen as somebody, sort of like a disease for older people. You've talked about the gender. We've talked about men. They're the ones who carry it the most but don't go for enough screening. For women, you look at all of the different things that happen with us, whether it's the hormones, whether it's perimenopause, all of these things. What are some of those quote-unquote risk factors, if I can say that, purely because of what biologically happens in a woman's body?
Yeah, so the woman's body produces estrogen. Estrogen is protective. Why? Because estrogen actually helps your blood vessels to dilate. And by your blood vessels dilating, your blood pressure tends to become lower than men of equal risk factors of same age, for example. Now, what happens when you hit menopause is the estrogen effect is taken off. And when this estrogen effect comes off, your risk factor shoots, sometimes even higher than men of the same age. And as a result of that, you find that we're picking up people in their 50s and 60s with new onset of blood pressure, women. And I would recommend, for mothers or sisters, daughters who are 50, it would be important to emphasize that as you go through the perimenopausal side of life, to actively have screening done more frequently than normal.
Wow. I was just telling Doc in the break, I'm like, I hit 40 and life just, my body has just been doing all kinds of things. But I often say, and I say this on my socials as well, that it's really your body trying to tell you something, right? And so again, because it's a silent killer, quote unquote, How do you know? I know there's the screening, and I know, hey, Dr. Chola said, Janet, just go for screening. But somebody could be sitting home right now, they're perimenopausal or menopausal. They're planning on doing their screening a few weeks from now. But is there something that could be happening that could be a whisper? Like with women, is there whispers? Is it like migraines? Is it other things?
Yeah, so you sometimes can get symptoms like having a headache,
okay,
a random headache, not getting enough sleep. You feel like your heart is beating out of proportion. You feel more fatigued than usual. You find that when you exert yourself, you're not able to do the same level of exertion or exercise you used to be able to do. And when you take all this in totality, it's your body giving you telltale signs that something is wrong somewhere. And what to me tells me is that we need to get you checked. The beautiful thing about if you go to any hospital is, in your triage system, we're going to check your blood pressure. If your blood pressure is normal and you're having all these symptoms ongoing, then we have a checklist you'll go through and see this is, rule out this, rule in this. But the basic start-off point for today, check your blood pressure.
Is check your blood pressure. Yep. Okay. This is really, really informative, and I think this is why we wanted to have this conversation. Again, I'm going to ask all of you to keep sending in your questions. I'm seeing quite a bit of feedback coming in, quite a fair bit. We're going to come to the YouTube feedback in a moment. We also are opening up our WhatsApp. Purity Doc had asked you what exactly are you on aspirin for. If you're able to chat us right now, he's in studio. He could answer you right away. And of course, we are also looking at some of the live feeds like on Facebook. But we're wrapping up with Dr. Chola now. And I really appreciate how you've emphasized on something like screening. What sort of like patterns are you seeing in the next year or two that are concerning you? And what patterns are you seeing that are encouraging you when it comes to how Kenyans sort of like look out for their health, even maybe something that's come across your desk when it comes to treating hypertension?
Yeah, so let me start with what's concerning me because that's a big pressing thing. So the first thing is when I compare the data in our setup versus in the first world, we find that the effects of hypertension and the likes are more brutal in our population. You find that younger people have effects like heart failure. You find that younger people having strokes. You find that blood pressure is more difficult to control because of our inherent follow-up issues. You find that if you look at the economy versus the cost of treatment, there's a huge imbalance. So all these are concerning and things that we need to address. But what gives me the hope is we're having these conversations and we're having it on a public policy level. We're hopefully able to address this and have systems in place where our generation, the Gen Zs coming behind us, millennials, the Gen Zs behind us and Gen Alphas, they find we've already put systems in place that will reduce their risk factors. So we might not have the health our grandparents did, but we should not be forgetting about those who are coming behind us.
I love that. And just before we let you go, because I know we have Dr. Gitao coming in, there's somebody here who is saying, I'm a 22-year-old university student. I wanted to ask, are blood clots and hypertension the same thing? Are they different conditions? If they're different, how are they related? And can having one increase the risk of developing the other as briefly as you're able to?
So they're not the same thing. They all affect your blood vessels. But we find that if you have a blood clot in its own, when we see you in our cardiology clinic or internal medicine clinic, we try to figure out why did you have the blood clot and try and rule out different risk factors. It's beyond the scope of talk today. But about the relationship between the two, high blood pressure can predispose you to getting clots. Why? When you have high blood pressures, remember I talked about these pipes known as your blood vessels? It sort of shears and causes stress upon the wall of the blood vessel. As a result, you have factors that are produced that predispose you to forming a clot.
Okay.
And as a result, your risk goes up.
All right. Dr. Anthony Ochola, thank you so much for just taking time to break that down to us. Another thing we'll be doing, hopefully at some point, is just keep tracking these conversations and seeing what needs to be happening soon. In just a moment, we'll invite Dr. Diana Gitao. But for now, we're going to take a look at some feedback on screen. What steps do you take to keep your blood pressure under control? Somebody here says drinking a lot of water, exercise daily, meditation, I believe, eating fruits, low blood pressure to keep it high. I go for morning runs. Drink a lot of water and eat a lot of fruits and lots of meditation. And even I lost my physical form because I'm too deep in. Right, we're now going to invite Dr. Diana Gitao. She's coming into the set right now. And we're just going to be having a conversation with her, again, answering some of the other questions, some related to high blood pressure, some not. Of course, we're also going to be taking a look at YouTube. There's quite a bit on YouTube. Dr. Gitao is going to be joining us in just a moment. Karibu sana. And then we're going to go to YouTube because I can see there's quite a number of you who've asked questions. Brenda Njeru is saying, not related, I feel it's time we addressed dental care as a nation. 2 out of 5 people have cavities and dental-related problems. What measures are our health insurances as a country taking to ensure everyone enjoys their meals and treats without the fear of sensitivity in the mouth? When we talk health, most of the time we leave out dental care. Now I'm just ambushing Dr. Diana Gitao. She's only just sat down. Hi, Doc, first of all. How are you?
Hi, Janet. How are you?
I'm good. It's good to see. I feel like when I have a doctor on set, I just feel so safe. I'm like, whatever happens, we're in good hands. Before we just get into the into what we're talking about, hypertension, somebody there raising the alarm and sounding the alarm around dental care. Mm-hmm. And they're saying, this conversation of hypertension aside, guys, we're having a dental care crisis. Mm-hmm. Quickly, what are your thoughts on that and whether we're missing something when it comes to dental care?
It's interesting. Dental crisis could come in different forms, right? So is it, number one, I've had cases or I've heard of people talking about they're having dental issues, but there's also the practice of dental care. We're having a lot of people who are going to, you'd want to say quacks, you'd want to say people who are not necessarily qualified to address the issue, right? So we're having two forms. There are increase in cases, but also the quacks, so to speak, right? Because not everyone is licensed to give you a root canal, right? They might be able to look at your teeth, but not do the root canal. So it's in two forms, I would say.
Thank you for saying that. And by the way, this is what we like to call the health hotline. And this is why Dr. Diana Gitao is here. She's able to really look at those ways in which she's able to give you as much information in the time that we have. So this is the health hotline, and the health hotline is hot on YouTube today. We'll see if we can bring up some of those comments and invite Dr. Gitao to just give us her thoughts. Monica Mutua says, hello, Healthy Nation. I have numbness on my hands and tickling now and then. Can this be an alarm? It appears and disappears, especially when I hold a baby or carry my nerves. I think we can do this as a quick fire. So that's the first question for Monica. What do you think she is dealing with?
I would say, first, obviously, consult a doctor. But it seems to me it's more towards nerve related, given she's talking about carrying a baby when there is strain. So could it be something relating to nerves in her hand? So seek care, but more likely it's nerves than high blood pressure in itself. Yeah.
Okay. And Monica, again, if we can bring that up, she says, hi, Doc and Janet, I have high blood pressure, but well controlled, but sometimes it gets too low when I take medication. What should I do? And sometimes at night, I get heart palpitations.
That's interesting. And it's one thing I had hoped Ochola will mention, Dr. Ochola, who's a classmate. But one, you need a review of your medication. So if you're on hypertensive drugs, you need it reviewed. Because if you're getting low blood pressure, that needs review. And also, if you're having, say, dizziness at night or palpitations in the morning or vice versa, that also requires review as well. Mm-hmm. So it's important that your medication is not standard the entire time. So get a review.
Because, you need to review it and see how it needs to be adjusted. Somebody here called Winnie Alice says, why does hypertension reoccur after eclampsia? What are the risk factors? So maybe talk about eclampsia. Somebody else has talked about, please talk about pre-eclampsia. Maybe let's unpack some of these terms and then bring in how hypertension plays a role.
Okay, and these are very broad categories on their own. So just very briefly, preeclampsia occurs as hypertension when you're pregnant, right? And this is various factors. One, it could be just you carrying the baby. Obviously, there are changes, right? So if you've had preeclampsia, eclampsia, meaning during pregnancy, chances are that you will continue having some sort lot of high blood pressure, especially if it's not monitored, if it's not treated when you're pregnant. So the point there is that if you've had high blood pressure issues when you're pregnant, after you've delivered, you need to go back to a doctor and have it checked as well and continue the regular screening. Yeah.
Yeah, because it's some of those concerns that also happen in pregnancy. I know this is something I would hear a lot, which is people who had to have their blood pressure checked during pregnancy. It was spiking, it was dipping, and it's often quite frightening. Dr. Ochola had talked about how it presents at his doorstep when it's really at the tail end, when things are already so thick. From your own experience, Dr. Ari, when you talk to your patients, when you're talking to people, what are the things that they say and think about hypertension that kind of concerns you, that you realize, hey, Hapa, there's a gap, there's a lack of understanding?
I'm glad you asked that, because headache, because a lot of people would say that, you know what, it's a hot day, I haven't drank water, so they dismiss this headache, right? Then when you finally have this conversation with them, they're saying, oh, I had a headache, I had vision changes, I felt pain here. But you see, it's retrospective, because you always dismiss this pain symptoms, because anything that's not normal is abnormal, right? If it's out of routine, you need to get it checked. So always, if you find yourself having persistent headache, even that dizziness in the morning, you're getting out of bed and you're thinking, I'm feeling dizzy or I'm feeling faint, don't just dismiss it that I did not have a good meal, right?
I feel like, today Doc is speaking loudly to me. You know, there's a time I went through dizzy spells. I was going through a lot of sort of like, I would say, trauma in my life, right? So I do remember the things that were foreign to me was dizzy spells, and migraines. And of course, I did this thing where I'm just like, it's just a season. I did go for a checkup there. I remember at the time they said your white blood cell count is low. Anyway, long story short, I was put on something and told to rest. And eventually they left as I dealt with the trauma. Stress is also a factor, right, in trauma. That's something that you've seen?
It's a very big factor. The key there as well, you might have stress for a season, but remember, if it does persist, right, you got help. If you're stressed for a period and you don't get help, that can lead to something else.
Okay, so it manifests and becomes something bigger.
Absolutely.
We're still going to go. Here we have a WhatsApp message here. This is from Duncan saying, sometimes after I've had a sit down for like 30 minutes of thinking, if I stand up, I lose control and I might even fall down. What might that be? Right.
Oh, wow.
Okay.
First, falling down is not just a regular issue. So that needs urgent attention, right? That's number one. And the causes could be starting off from low blood pressure as opposed to high blood pressure as well.
Talk to us about that.
So there are multiple things in all these things, right? So he's talked about the fact that he's thinking a lot, right? His stress, it could be high. But he's also talking about the fact that he's standing up and falling down. Is it a factor that, you know, as you rise up, then is it too fast as well? Yeah. Low blood pressure, low blood sugar as well, right? So it's both ends. However, the fact that you stand up and you fall down is a very big point of concern. Yeah.
You know, people here, please get checked, and they're just like, how there is that stigma, Doc. And I don't know how we're going to, through this platform, encourage people to get checked. I get that, and I think Dr. Chola kind of alluded to it, is that there's those economic matters. But from your purview, is there something else that just keeps Kenyans from not getting checked up? Is it a sort of like a stigma beyond finances? What else is there, beyond even the people who have to walk far distances and all of that? What do you think it is? Because a lot of this, as you've said, you can get checked, but we're not getting checked. Why?
I think there's also the fear of, I would say, the fear of the unknown. I will go in thinking it's just a headache. Then I discover it's something more. I will go in for a routine checkup. I discover I have cancer. What do I do then? Maybe I should just live my life as is. So there is an element, it's not stigma, but it's that fear. Maybe it's a sign of something that I cannot handle, right? So there is that element. And I think a big part as well is not just getting checked, is also call lines. I feel like sometimes if you had call lines, not for diagnosis, but being able to talk to someone and to say, as we're doing here, if you're standing up and you're fainting, you need to see a doctor now, not tomorrow. Or if it's tomorrow, it must be tomorrow, not next week, next month, you know.
Oh, you're saying call-ins, like people to just be able to sound the alarm. I like that you've talked about the fear of the unknown. So maybe talk to us this evening. How do people begin to just navigate past that? Because we could have all these conversations and they're important that we're having them. But if people leave this and say, it's okay, I don't think that I want to know what's happening with me, what would you say to somebody like that?
I think a big part is you're never alone. And what I've seen increasingly in hospitals is that there are support groups. So if you walk into most, I would say, public hospitals as well, if not an existing support group within the hospital, if you simply looked up high blood pressure, diabetes support group, you'd find something. And you always find they're spread across the country. If you're in Bungoma, if you're in Garissa, Marsabit, you'll find somewhere close by where there's a support group you can speak to, someone who's walked your shoes. And that matters because at the end of the day, you don't need to go through it alone.
Yeah.
Absolutely.
Honestly, thank you for speaking to that, because I think somebody just needed that extra bit of courage to know that whatever happens, whatever comes out of your checkup, that you're going to have somebody to support you. Was there anything else pressing that you thought was important to speak to, Doc, for the hotline? Because again, people are asking things related to the topic at hand, but just other things that they're interested in.
There's this question around the pink salt, the Himalayan salt, yeah? Is it better than the white salt? And I think Ochola would agree with me that salt is salt, right? And fundamentally, remember, salt isn't just the salt you add in your food. The food you're already cooking, processed food, has salt in it. That already counts to your salt intake. So if you're adding salt, you've already had salt. The pink salt isn't necessarily better. It might have more electrolytes, but it isn't necessarily better. So it doesn't mean you add more because it's pink.
Right. Because therefore it's not as harmful. There was also somebody who talked about the blue skin. And I think Dr. Chola talked about, sometimes there's a link. Bruising. Do you want to speak to that briefly as we also go into this final one? Just very briefly. Or actually, maybe we can combine, Doc, as we go into that. It also says, what causes the diastolic pressure? I'm so sorry if I'm massacring. What did you call it, Doc?
Diastolic
pressure to take long to resolve compared to the systolic pressure after taking medication, having established that they are both elevated.
Okay, so on the blue skin, what would be important there to mention is that there's a trend also about taking aspirin, right? Because a lot of people, or I think a while back, there was you should take aspirin maybe weekly or a certain period. And this was recommended to people who have had a previous history of heart attack. What I've seen increasingly is people are taking aspirin and saying, you know what, I won't get a heart attack without, previous history, right? And that's not the case. As Dr. Chola mentioned, that will give you a risk of, bleeding and so on and so forth, right? So there's caution there, even just aspirin in itself, taking it preventive. Diastolic pressure. Why would Ochola be best in this? But I'll try. So I would take it that systolic would take faster, just because your heart pumping the diastolic goes to your body system. So body is faster than your lung, which is the diastolic pressure. That's the short of it.
That's the short of it.
Yeah.
That's what we have for the health hotline today. We really appreciate Dr. Diana Gitao for just being able to answer a broad array of questions. As we said earlier, we thank Dr. Ochola as well for talking to us about hypertension. And for us, it's just for you to remember that it's 1 in 4 adults, right, who have this. It's a communication thing. It's a trust issue. But whatever the case, the message today is clear. Please get checked. Tell the loved ones around you to get checked. This matters to us all. I'm Janet Bogwa. Thank you for staying with Healthy Nation. We can keep the conversation going online until we're back next week with another conversation. Enjoy the World Cup final. Spain, Argentina, whoever your team is, enjoy it and be careful and stay safe.